Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is briefly made clear and often illustrated. Let's start. Today's topic is about septic arthritis. You should know 8 important things about septic arthritis. First thing is risk factors, then cause, symptom, predisposing factors, why the disease setting, how to establish the diagnosis, microorganisms involved, and management. Risk factors: 4 to 29 cases per 100,000 persons a year. 85% have an underlying medical condition. 59% of these had a previous joint disorder. Predisposing factors include age over 80, diabetes mellitus, osteoarthritis, rheumatoid arthritis, anti-tumor necrosis factor treatment, intravenous drug abuse, recent joint surgery, hip or knee replacement, in HIV and sepsis. In septic arthritis is about monoarticulation. It's exceptional to have polyarticulation. There is no symmetry, and there is a decreased active and passive range of motion. There is often a pre-existing joint destruction from rheumatoid arthritis or osteoarthritis. In septic arthritis, it's a rapid joint destruction. It's in days. This is important to establish the condition in no time. To establish the diagnosis, we use arthrocentesis. 4 things to know about arthrocentesis. 3C. The first one is cell count. The second one is crystal. And the third one is culture and gram stain. When it's about septic arthritis, it's over 50,000 cells, but no crystal. Often gram stain and culture are negative. Causal factor depend of the age. Under 14, it's gonococcal diplococcysis negative staining, but over 40, around 16, 17, it's about staphylococcus and gram-negative bacteria. Under 40, Diplococcus, gonococcus. Over 40, 50, 60, 70, Staph aureus and gram-negative. Remember, you have to install the treatment instantly. It's ceftriaxone. It's about gonococcal, it's ceftriaxone. But if it's no gonococcal, it's ceftriaxone and vancomycin or Nafcillin. We don't have time to make a culture, and often the culture is negative. Start the management by the way. Gonococcal, ceftriaxone, no gonococcal, ceftriaxone plus vancomycin or Nafcillin. Just to review, risk factors include 4 to 29 cases for 100,000 persons. 85% have underlying medical condition, and 59% of them have previous joint disorder. Predisposing factors include age over 80, diabetes, osteoarthritis, rheumatoid arthritis, anti-tumor necrosis factor treatment, intravenous drug abuse, recent joint surgery, hip or knee replacement, and HIV sepsis. Remember, it's monoarticular, no symmetry, and there is a decreased active and passive range of motion. There is often a pre-existent joint destruction from rheumatoid arthritis or osteoarthritis. Remember, the setup is so rapid, the destruction could happen in a day. Arthrocentesis, 3C and gram stain. The first C is cell account, the second is crystal, the third is culture. The diagnosis is established with 50,000 and no crystal. 50,000 cell and no crystal. Remember, gram stain and culture are usually negative. Microorganisms that cause the disease, if under 40, it's Diplococcus gonococcus. If it's over 40, 50, 60, it's Staphylococcus and gram-negative bacteria. Ceftriaxone if gonococcus, Vancomycin and Ceftriaxone if no gonococcus. Please support the channel by buying this mysterious weaver at Kindle edition. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.